Welcome everyone to today's webinar. We are so pleased to host our annual World Elder Abuse Awareness Day National Virtual Forum on Elder Abuse Awareness Day, which is on June 15th, this Saturday. And we are hosting this prior to the event because we know that many organizations are doing other events and activities on that day. I want to acknowledge I'm with Elder Abuse Prevention Ontario. I'm part of a planning committee that is hosting this year's event. You will see on screen all of our community partners that have been involved in planning this excellent event that we're hosting today. And we will be providing more information of our contact information and resources from those organizations that have partnered with us across Canada to host this event. Our theme for this year is Be Old or Bold, Age with Attitude. We're so pleased to have a different theme this year to bring some sort of spice and some recognition around changing the mindset of how we're aging. And our panel and guests will speak to that as we go through our presentation today. So before we begin, I do want to introduce my colleague, Benedict Schifflin, who's going to provide us some housekeeping notes for the session today. Benedict is with the Canadian Network for the Prevention of Elder Abuse, and she has been one of the key stakeholders involved in planning this day. So Benedict?
Thank you, Ryan. Hello, everyone. I hope you're all doing well. So as Ryan said, a couple of housekeeping notes before we get started. As you may have noticed, your cameras and microphones are automatically turned off. That is to preserve the quality of the sound, particularly. But this doesn't mean that we don't want to hear from you. So if you have questions or comments, if you wish to interact with each other, please use the chat box. And if you want to ask questions for our panelists and presenters, please use the Q&A box that's at the bottom of your screen. We will be keeping an eye on the Q&A box, and we'll be reading your questions out at the end. As Ryan mentioned as well, we today are very lucky to have both ASL and LSQ interpreters. You can see them, they're multi-pinned. You should be able to view all speakers, including the interpreters, by clicking on the little gallery view or the view icon and choosing gallery view. We also have interpreters, so that's Francophone attendees can listen in French. So you can click the little globe icon at the bottom of your screen to have the French channel. And finally, you always have full control over how you see us and how you see your screen. So, when a speaker is on, you can choose to kind of move and drag the little invisible line to the left or to the right to make their image bigger or smaller. I see a lot of people saying hi in the chat box. It's so great to see all of you. I recognize some names. Hello, everyone. A couple of more things. Evaluation. We always want to hear how we're doing. It really helps us for future events. So after the session, you'll see a little pop-up screen that will invite you to complete a very short survey. Your feedback is always appreciated. Please do take it if you have a minute. And of course, we are recording the session. So we will be posting a full recording of this event in the next week or so. And you will find those or the recording both on EAPO's site, eapon.ca, and on cnpea.ca. And then again, at the bottom, you can see some hashtags. So if you feel so moved and you are a social media fiend, please use those hashtags and post some messages, tell people about WEAAD, tell them why it matters, or even better, invite them to join us, even if we've just started. Anything else, Ryan? Am I forgetting anything?
No, you've got it all. It's great. Just in terms of the questions, to put the questions in the question box, and that we will take time at the end or during the session to answer your questions that may arise. So Benedict will be managing that as well during the session. So before we formally begin, I want to provide our land acknowledgement. We acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship of this land throughout the ages. We seek a new relationship with the original peoples of this land, one that is based in honor and deep respect. It gives me great privilege to welcome Debra Sayewich, who is going to provide our opening remarks today. Debra is a member of the Wasauksing First Nations. She's the founder of the Age Friendly Consulting and co-founder of OAKS, the Older Adults Knowledge Sharing. And we're so pleased to have Debra. She joined us last year, and we're pleased that she's able to attend this year to provide our opening remarks. Debra?
Miigwech, Rayanne, and Miigwech, and Ani to each and every one of you today. Greetings to each of you as we come together on this virtual platform from across this great land, Turtle Island. Today, may we acknowledge all the relations that we have with each other. May we come together in a good way. I would also like to acknowledge that many of you have gathered at this table from remote and urban communities. Welcome. June, we celebrate Seniors Month, National Indigenous History Month, and WEAAD, and I'm very humbled to be invited to this table today. Manu, it is good. Today we are in balance. Our words are in alignment with what we do. We walk the walk, we talk the talk. We need to create a space within ourselves to learn. Ani, I'm an Anishinaabe from Wasauksing First Nation on the beautiful shores of Georgian Bay. Wasauksing, our Ojibwe name. Wasauksing First Nation means the place that shines brightly in the reflection of the sacred light. As a member of Wasauksing First Nation, I'm also a member of Robinson-Huron Treaty 1850 on the beautiful shores. My Ojibwe name, Gidikokwa, Resource Spirit Woman, which means up the hill woman, one who will have resources for everyone as we walk up the hill together, one foot in front of the other. When I was blessed with this name by our elder, she shared with me that this name will continue to teach you and guide you what you are meant to do on your journey. Many, many years later, I truly understand what she truly meant. I am the eldest of 5, married 40 plus years, mother of 2 grown children, and I've been blessed with 6 beautiful grandchildren. My mom, now in her 87th year, continues to share her wisdom, love, and support to the individual that I am today. My vessel is something that I do not take for granted. Within our Anishinaabe people, we have our teachings of our 7 grandfathers: wisdom, love, respect, bravery, honesty, humility, and truth. The story and teachings have been passed on by our elders for many, many moons. Each of these teachings must be used with the rest. You cannot have wisdom without love, respect, bravery, honesty, humility, and truth. Truth is to know all of these things. Speak the truth. Do not deceive yourself or others. When sitting in circle with my relations, I hold these teachings very close to my heart. I would like to share some answers to many questions that I receive when asked. And fear not, you can always ask a question. It's always good to ask a question when in doubt, respectfully. May I ask that when you move forward in a good way, do not come to the table with an agenda. Have a level of cultural awareness and sensitivity. Take the time to build the relationship. Get to know us. Listen to the pause. Even though I didn't say something, my heart shared something. Create a respectful environment by treating everyone around the circle as equal. Come prepared to listen carefully and build the trust. And today, when you have the opportunity to hear some amazing sharing, of knowledge and wisdom from our panelists today, your hearts will sing with joy that you've taken this time to expand. I too ask permission when I sit in circle. Is it the right thing to do? When sitting in circle and asking and sharing what is ageism or what is abuse of older adults, we are opening new doors. And it's a conversation that's spoken from the heart. Every year on June 15th, we all join forces to remind the world that older people have rights, who deserve to live from ageism, abuse, and neglect. Together, we are all part of the shared journey to create a safe and supportive society, working together to achieve a shared vision. All voices matter. Building relationships is the path to reconciliation. Miigwech, and enjoy this amazing afternoon.
Thank you so much, Debra. It was the words for us all to follow and to remember when we are working with older adults and our elders in our communities and with each other as we move forward. So Miigwech, we really appreciate you coming today and giving us your words of guidance today. I would now like to introduce our moderator for today's session, Laura Tamblyn-Watts, who is the CEO of CanAge. Many of you have probably seen her on media and as a voice for older Canadians. So Laura is a lawyer, advocate, and author of a recent book that she's just published called Let's Talk About Aging Parents, a real life guide to solving problems with 27 essential conversations. Laura's focus has been on law, aging, elder abuse, accessibility, law reform, governance, knowledge mobilization, and so much more. She used to be previously the Chief Public Policy Officer at the Canadian Association of Retired Persons and the National Director of the Canadian Centre for Elder Law. So Laura, it gives us great pleasure for you to join us again and also be a key partner in organizing today's event. I'm going to turn it over to you to moderate today's session and go forward and introducing the webinar today, give some background.
Thanks very much. And I do just want to off the start, thanks to the organizing committee, Rayanne and Benedict, especially for all their tireless work. It takes a year to create this event, and I just wanted to make sure that we share our appreciation with the organizers. Many of you will know WEAAD well. Many of you are hosting WEAAD events yourself. But I do just want to take a small moment because it's especially poignant in our following dedication to the award. So WEAAD World Elder Abuse Awareness Day was the vision of Dr. Elizabeth Podniak. It is a United Nations formally recognized day. And you can see through our chat box today that we actually have people coast to coast to coast celebrating with us, and in fact, around the world as well. WEAAD is a day we take and learn and share from each other. It's a day that we acknowledge harms that are done to older adults. It's a day that we aspire to do better as individuals, communities, and countries. It's a day that globally we recognize that we are not alone in our journey. It's a day that we can reach out and learn from each other in other countries. And I know how meaningful and important it is that we recognize it in villages, municipalities, cities, provinces, organizations, regulators, schools, universities, as well as federally and internationally. And that grassroots, bottom-up and top-down approach is really evocative of the change that we need to make within ourselves and within the countries that we live. It is a poignant year this year with the passing of our beloved Dr. Elizabeth Podniak. And before we give out the award in her honor, I want to invite to the stage her daughter, Elizabeth Podniak, or Liz, as we call her, to say a few words about WEAAD, about her mother, and to share a little bit of perspective in the role that WEAAD played in the lives, not just of us together, but also within her family. So with no further ado, I'll ask Liz to join us on the stage and spend a few moments with us.
Hi there. Thank you so much. I want to begin by offering my thanks to Laura, Tamblyn, Watts, and to all the members of CanAge for inviting me here today. I'm most grateful for the opportunity to say a few words before Benedict receives the Elizabeth Podniak Award for Elder Rights in Canada. As you know, my beautiful mother passed away in February. Given that CanAge honored my mother with an award in her name, I know you're already familiar with her outstanding professional achievements. Her research, advocacy, and activism were boundless. I also note that many of you knew Beth not just as a colleague, but as a friend, and thus you have experienced firsthand her remarkable spirit of generosity, encouragement, and kindness. Speaking to you as her daughter, Beth was, above all, a fiercely devoted and committed mother to me and my brother Andrew, who is sorry he's not able to be here today. Our mother's superhuman energies were always and forever manifested in her role as a parent. She loved us and supported us unconditionally, serving as our doting mother, but also as our mentor, our leader by example. As Andrew and I wrote in her obituary, we loved her unreservedly for her laughter and wisdom, for her emotional connection to nature, to trees and plants and oceans. And as I'm sure many of you have observed, for her singular sense of fashion and refusal to wear practical shoes. With the addition of my children, Zachary and Emily, to the family, our mother became a grandmother. She approached her new role as Grammy, a name she sought to, how am I going to be called? She chose to be called Grammy. She approached this new role with intensity and joy. She proudly evidenced the assertion, as I quote from Carol Roy's book, The Raging Grannies, that a granny isn't a grandmother, a granny is a frame of mind, attitude. It was likely in this frame of mind that she took her grandson to the movie Barbie just last year. Yes, she wore pink, her best pink blazer. Her longtime crush on Ryan Gosling kept her lighthearted and youthful, even as she approached her 95th year. A few years ago, Beth drafted some notes and reflections on the subject of grandmothers. She emphasized how, quote, grandmothers miraculously are radiating one of life's great qualities, resilience, and gracefully survive the extremes of life experiences, unquote. Indeed, it was as a Grammy that Beth gained the greatest empathy with those elders whose lives she worked so tirelessly to protect and to champion. My brother and I are profoundly grateful to CanAge for celebrating our mother in perpetuity with the Elizabeth Podniak Award. Her professional and personal dedication to preventing and raising awareness of elder abuse and neglect encapsulates her passion, her work ethic, and her own spirit of resiliency, which continues to radiate within us all. Thank you so much, and congratulations to Benedict. Thank you.
Thanks so much, Liz. And I put her brilliantly worded obituary in the link, and I encourage everyone to read it. I never quite got the courage to call her Beth, though she offered that to me many, many times.
I'm sure she did.
But It is that close network and close connection, I think, that really speaks to her legacy. And so I'll ask you to stay on the stage, if you will, while I say a few words about our this year's awardee.
Yes, absolutely.
One of the reasons that we created the Elizabeth Podniak Award for Elder Rights in Canada is that, frankly, we so rarely take time to recognize the tireless work of heroes in our field. Usually the award is presented by the Minister of Seniors, or a fancy politician does it. But we knew that that was just not our 2024 awardees style. And I asked the planning committee if I could present it instead, along with Liz, and they very generously agreed. And I'm really grateful that Liz and I have this opportunity. As background, the award was created in the first year of the pandemic, with Dr. Podniak as our original awardee in June 2020. And thereafter, on behalf of CanAge, I've had the privilege of consulting with Dr. Podniak annually about who should be the nominee for this award. This award recognizes leadership, inspiration, determination, and the unwavering commitment to advancing the rights of older Canadians. Each year, we'd meet on Zoom together and shortlist. Zoom because of the pandemic. This past year was the last time that I'll have had that profound privilege, as she passed away recently. But as each of us pulled out our shortlist together, we said simultaneously to each other, it must be Benedict. This award is given to someone who's an inspiration to others, a vanguard in the field, and a hero of elder rights in this country. There is no better person to receive this award, especially for us in this poignant year, than CNPA's Executive Director, Benedict Chaufflin, a woman of many talents. Benedict has blended her background in academics, languages, artistic and cultural sectors with her communications acumen and not-for-profit management excellence. I have had the profound pleasure of working with Benedict when she came on board our team at the BC Law Institute and the Canadian Centre for Elder Law now decades ago. Since then, we've also had the privilege of working with Benedict in her role at the Canadian Network for the Prevention of Elder Abuse since 2015, and cheered hugely when she became formally its executive director in 2018. Since that time, we've all been in awe of her intelligence, cultural acumen, tireless work, and inspiring persistence in the area of elder rights. Never one to rush into the spotlight, Benedict has led from behind, from within, and only when required from the front. A profound introvert, Benedict has led events, advocated at the United Nations, hosted innumerable webinars, led projects like Future Us, setting out a pathway for elder rights in Canada, made powerful submissions to government, worked to change laws, policies, hearts and minds. And at the end of a recent 3-day conference hosted by our friends at HelpAge Canada, trailing right on the back of a week at the United Nations, I turned to Benedict and told her, you know, even as an extrovert, I'm pretty peopled out. How do you do it? She just laughed and welcomed me to the club. Quiet, humble leadership, spiced with sharp wit and grace with an indomitable sense of justice and fairness. Benedict, we see you and we see your work. We acknowledge your tireless efforts, and we are grateful every day for you coming to Canada from your native France and quite literally improving the lives of hundreds of thousands of seniors across this country and around the world. In short, when you blend together integrity, grit, excellence, determination, character, and humor, you get this year's Dr. Elizabeth Podniak's awardee for elder rights in Canada, a friend to all Canadian older adults, a friend to the sector, and I'm very proud to say a friend of mine, Benedict Chaufflin. Please join me in congratulating Benedict and inviting her to the stage.
Laura, I'm going to hire you as a PR person for me. Thank you so much. It's really an honor to be here. It's an honor to receive this prize. It does mean a lot. As much as I like to say, I don't put much stock in these things usually. But yeah, like you said, I was reflecting on the past 9 years, because it's been 9 years since I've been at CNPA. And the thing that really sticks out to me is the tight-knit community of the elder abuse prevention people, right? I arrived and I landed in this nest of incredible people who work tirelessly at the local level, at the national level, at the provincial level, to make the lives of older people better, to make them safer. And I didn't know that much, right? So I was supported and I was mentored by incredibly knowledgeable, generous people all the way through, many of whom are in this room right now, the Zoom room right now. Elizabeth Poniaks was also among the people who believed in me, who opened the door, who taught me a lot in a very short time. And yeah, she really inspired the theme Age with Attitude. I can't believe it took us so long to get to the theme of Age with Attitude, because the work that we do is full of strong, fierce people, rebels who are hell-bent on changing the world and who are not ready to be relegated to second-class citizens and to be told that they're too old to say or do anything. So none of them, many of whom are here today, are doing this for the glory or for the money. They do it because they believe that we hold value at every age. They believe that they can make things happen every day. They step up every day, very often with very little funding, so that we can all benefit as we get older. And so all these people who are present today, and the ones who are not here anymore or couldn't make it today, have, they inspired me. They ignited a passion in me, fully consuming, overwhelming passion for this work. And I do hope that it will also inspire you today, that it will fire you up to take action in your own lives, in your own circles of influence. I feel really lucky to be here and emotional, and I don't like it. Thank you so much.
Thank you so, Benedict. And I do hope that your actual award shows up today. I did put a little bit of what it looks like on the screen, but I did just want to show you that will be showing up for you today. And we really hope that you'll have an opportunity to celebrate this evening and make sure that you know that this is something that is heartfelt from all of us. With that, we get to move to our next part of our show, which is going to be a wonderful presentation. We have here a kickoff keynote by Dr. Saskia Sabathian, who has been a friend of and a leader in the field of dementia and aging for many, many years. We then followed up with some brief remarks and a panel conversation amongst our speakers, including Executive Director Alyssa Brierley from the National Institute on Aging, Julia Gersovitz, who is just a fabulous leader in Canada and around the world, thinking about architecture, but also reflecting on some of her experiences personally, and of course, Gregor Sneddon, the Executive Director of HelpAge Canada. The discussion today convenes citizens, advocates, professionals, and leaders, all of whom are tackling issues of ageism and elder abuse. Their perspectives provide inspiration and pathways to change. We're hoping to change that narrative as well as change the laws and policies. We know how we speak about aging and how we speak about abuse is fundamental to changing those things as well. Our theme this year is Age with Attitude, and we absolutely know that when we're thinking about attitude, we get that as well from our inspiration of Dr. Elizabeth Poniak. With no further ado, I'm going to invite our keynote kickoff speaker to the stage. Saskia, if you would like to join us, and I'll just put a few words. I promise not to embarrass you too much with your full bio, which will also be in the links and also shared on the screen. Many of you will know her as a leading healthcare leader, a passionate advocate, the voice of dementia in Canada and globally. She's worked with numerous health systems to really help functionally change strategies and provide better solutions. She's got appointments at a variety of universities, including McGill. She's, of course, served as the Chief Research and Knowledge Translation Officer at the Alzheimer's Society of Canada. She has worked within government, such as being appointed to the Federal Minister of Health for the Ministerial Advisory Board on Dementia. She's worked with the World Health Organization on its global dementia strategy, co-drafting the WHO's Global Action Plan on the public health response to dementia. That got unanimous consensus at the World Health Assembly. That's helped, of course, as you will know, to take that global piece down to the template for drafting Canada's national dementia strategy as well. Serving as a representative on the WHO at the OECD, the European Commission, the EU Joint Program on Neurodegenerative Disease Research, Alzheimer's Disease International, you can't go anywhere without being constantly impressed by her leadership, her passion, her wit, her intelligence. And I am so proud to say that she is also focusing on some of the intersections that we know that go with cognitive impairment and the risk for elder abuse and neglect. Sadly, one of the predictors in many cases for elder abuse and neglect. With no further ado, I turn it over to you. Thank you very much.
Thank you so much, Laura. I thought you were not going to embarrass me. That was very hard to sit through, but I very much appreciate it. Thank you so much, everyone, for being here today. Thank you for the invitation from the organizers of this event. It's an absolute pleasure. I'm going to try and take limited time because I think we're going to have a really important and robust conversation with all of the panelists later today. So let me start by sharing my screen, and I'll take us through. Please let me know if you can see this. A quick thumbs up, maybe. Yes, perfect. Thank you, Laura. So in keeping with today's theme, when I was invited to speak, I was asked to speak about a bold initiative, an initiative that I believe in, that I'm passionate about, that I think will help move us forward. And as you've heard, the work that I've done and that I've done with these wonderful colleagues that I'll be speaking about in a minute has been in the field of dementia. And, you know, as my colleague Alex put it aptly, people living with dementia are probably the most vulnerable when we think about elder abuse and their voices not being heard. So it's my pleasure to be able to speak about this today. Let me start by laying the context for why dementia as a system of care that we need and supports that we need hasn't changed dramatically enough for Canadians and what we feel we can do about it. So there are 1.7 million Canadians currently living who will be living with dementia by 2050. That itself is a large number. But if you consider that dementia is one of those diseases that crosses every boundary, it goes beyond health. It impacts your ability to engage in your community. It impacts your ability to work, your family. So in fact, for every person who's living with dementia, there is at least one caregiver, if not many, many more, especially as this disease progresses. So the 1.7 million really means about 4 million, if not more, Canadians will be impacted by the effects of dementia. Now, Canada has a national dementia strategy that was launched in 2019, as Laura mentioned earlier, and it is an excellent strategy that really talks about what we could hope to aspire to if we're able to address all of the pressing needs of Canadians living with dementia and impacted by dementia. The strategy has some fantastic principles, which include equity, inclusion, and acknowledging the vulnerability and needs of older adults. The strategy was launched in 2019, and I would note that it had 5 years of funding. That funding expires this year. The strategy, unfortunately, does not have any goals in the sense of tangible goals that we can measure to know how we are moving forward. And I think this is really one of the key starting points for us. In the strategy, they ask Canadians, how do you feel about dementia? And what do you know about dementia? And you can see here, almost 80% of Canadians believe dementia is having a moderate to significant impact in Canada. And yet only 23% are taking steps to reduce their risk of dementia. And that's only a slight increase from baseline in 2019, which was 21%. I think the more concerning statistic is that 63% now worry about developing dementia, up from 49%, so it's almost a 13% jump. And many are afraid to discuss this with their physicians or with their families, overwhelmingly out of a fear of what lies ahead. To me, this means that we have not done a good job of dealing with the stigma around this disease, the stigma around the vulnerability of living with this, and what comes after, the fear. Now, I also want to point out that, as we mentioned, for every person living with dementia, there's a care partner. That comes with millions of hours of informal care that is unpaid and often completely unacknowledged. When I was at the Alzheimer's Society of Canada, we launched what we called a series of landmark studies to understand the lay of the land here. And that's where that 1.7 million projection comes from. But also, currently, 470 million hours of care is being provided to people living with dementia. If we were to translate that into jobs and paid for it, that would be 235,000 full-time jobs costing $7.3 billion. That's 2020. If we continue on the trajectory we're continuing on, by 2050, that number will triple. Things have to change, and they need to change significantly. What is it looking at globally? I'll just touch on a few things very, very quickly. Globally, up to 75% of people living with dementia are going undiagnosed. In Canada, we don't even know what that number is because we're not measuring it. The estimate is about 50%. And then up to 85% of those people living with dementia are not getting access to post-diagnostic care. Again, we have no idea what that looks like at in Canada because we don't measure it. Women are disproportionately impacted by dementia living with it, but also as caregivers. And we talked about the enormous number of unpaid care that goes into supporting people living with dementia. That's women. And we don't really understand, and we provide very little supports to be able to enable what is the backbone of care for dementia. Taking a step back even further and looking at it from a health systems perspective, only about 40% of family physicians feel prepared to diagnose and manage dementia. And this is in Canada. And it's much lower compared to other countries like Norway and the UK, which are more in the 60 to 70%. Now, I'll note that that number is dated. It's from an older study from CanAge. And as hard as I looked, I could not find newer data. And that's the other piece that I would talk a little bit more about, the need for evidence, data to help drive policy and change. What gets measured gets done. We know that on average, physicians are receiving less than 20 hours of training on dementia in medical school. And in Canada, where family physicians are the entry point into the health system, family physicians are burnt out. Primary care is not well designed to support people living with dementia or older adults generally. And we know that when someone comes in who is living with dementia, they rarely just have dementia. They often have many other chronic conditions and diseases that are not that complicate overall care. And we know that now, between 1991 to 2021, the hours worked by family physicians have decreased 7 hours less per week, and that's only going to continue. Well, what about if we shift to specialized care and people like geriatricians who could provide better care? Well, again, in Canada, where we have one geriatrician for every 17,500 older adults, the target should be 1 per 8,000. So there is a lot within our health system and within our landscape generally that needs to shift in terms of supports and policies. I'm going to touch on one other piece, which is around accessing health information and the rise of, in essence, health influencers. Whoops, skipped ahead there. The rise of health influencers who are changing how people access health information. So a couple of key studies, the slides will be available, so please feel free to access them. But the takeaway is that overwhelmingly, a large percentage of the population, and especially the younger population, is accessing health information through social media, primarily, and sometimes as their only source of information, and that's health. But of course, it's the same for general news. The problem with this is that, yes, this is a fantastic new and accessible avenue. Misinformation is rampant through social media. And a recent physician assessment of social media posts found that 31% of these posts are not just misinformation and therefore could delay standard care. It's also providing potentially toxic information and leading to expensive and futile therapies. So there is a lot that we need to do around meeting people where they're accessing information, but providing it in a way that is accessible and usable. Which brings me to the initiative that ties to the theme of today and work that Alex and I have been doing to really try and address some of this. We began incubating an independent think tank that we call the Brainwell Institute. And the intention is to take evidence and really help to ignite change. There's a statistic that's fairly astounding, even to me as a researcher, is that it takes almost 17 years to move evidence into practice. And this is far too long for the kind of data and evidence that needs to ignite and change policy shifts and system changes. So through Brainwell, part of the work that we hope to do in this think tank is to provide evidence-based recommendations to policymakers, but also to really be a hub for international collaboration. Because as you've seen, other countries and health systems have already started thinking and working on these issues, but we do a very poor job of learning and building and moving that research and policy into our own work. The mission of Brainwell is to support independent, relevant research without compromise, and to combine authoritative journalism. And the reason for this is because we want to support actionable recommendations for dementia and brain health. And we want to ignite change. There needs to be system and policy level change that has to change quickly if we're going to be able to change any of the trajectories of care that we're seeing and where we're seeing the numbers of people who'll be living with dementia. Our vision, ultimately, is to promote change and to create a world where those who are impacted and affected by dementia can thrive. They're not just living in this world, they're thriving in the world, and where brain health is an everyday approach. As I mentioned, this is not an individual and will never be an individual piece of work. My co-founder is Alexandra Waite. She's a part of this, but of course, we're standing on the shoulders of giants, others who've gone before us, who've advocated and pushed for this kind of change and policy and evidence. And we would love to be able to collaborate with you if you're interested in being able to move more of this evidence into practice. What we're hoping Brainwell will offer ultimately is informed, incisive commentary and analysis, not just on the latest research in dementia, but on the most relevant research dementia. And I can say this as a researcher myself. Sometimes research will explore really interesting and nuanced topics, but it's not always what is relevant and needed for people who are living with dementia now. And I think this is a key nuance that we're going to try and address more specifically. As well, given what we know about the rise of social media, the use of social media, we want to be able to develop evidence-informed content for a younger audience, an audience between the ages of 30 to 60, because they also can be mobilized and be advocates who can support the kinds of voices that older adults need to be bringing forward and raising awareness about their own brain health and supporting the brain health of older adults. So I will pause there. Thank you very much, and happy to take questions later on.
Thanks very much. We really appreciate it. I think that the Brainwell Initiative is going to be absolutely transformative for Canadians and around the world. And I've put the link there in the chat for folks. One quick question I'll let you answer before we go. We had a quick question that I'm going to target to you. The question is this: is dementia worse today, and what are we doing wrong? I know that that's actually a complicated question as well as a complex question, but because it covers so many things, I'm just going to pose it to you today. Is it worse? And of course, the word worse is interesting. And what are we doing wrong?
Very multi-layered question, but thank you for asking that. Here is the way I would approach it. Dementia is now one of the leading causes of death, and especially in older adults. So I think if we look at it from a mortality perspective, yes, It is something that we need to be concerned about. If we look at it from a disability perspective as well, it is one of the leading causes of disability. So again, I don't think we could say that we have been shifting the needle so dramatically that it's moved down off of those lists. From a policy perspective, do we have good pathways of care to support people living with dementia? No. I mean, there are pieces that are improving, but if I were, and I have lived experience of this, it's frustrating and I'm not happy with the way it is. And so I think that there are big changes that could be made. There's institutional care. And is that addressing the needs of people living with dementia? I think that's a pretty resounding no. Are we wanting to change it? Is there interest in it? Yes. But have we truly shifted the care and the needs for people living with dementia? No, I don't think we have. And I think there's a lot more that we can do around it, but happy to chat further later.
That is the best answer to that question that I could have ever imagined. Thanks very much. I will now excuse you off stage and invite in our next speaker, kicking off our panel discussion. Alyssa Brierley is the Executive Director on the National Institute on Aging. We share a background in law. She has been a passionate advocate for people who have experienced marginalization, poverty, housing challenges, food security challenges. And when she brought her expertise in the grassroots sector, married it with her profound work within government. It is rare that you actually have someone who runs a not-for-profit who used to actually kind of approve the checks in Treasury. And that conversation is something that we need to know more about later. She joined the field of aging and we welcomed her with open arms. Her integrity, her passion, her intelligence, and her leadership has been transforming the work of the National Institute on Aging. And we're delighted to invite her to the stage today. Over to you, Alyssa.
Thank you very much, Laura. Sorry, just a question on format. Are we shifting into the panel discussion at this point? I thought,
pardon me, what I'm going to ask each of our panelists to do is introduce themselves, just talk a little bit about the work that you're doing broadly and what some of the work that you're doing has to do with thinking about vulnerability in older adults. I'm thinking as well about the new study on loneliness that came out that folks might be interested to. So invite you to spend about 5 or so minutes talking about what the NIA does, what you're doing, what you're thinking about in this area. Then I'll invite our next two speakers to do the same thing, and then we'll bring that whole panel conversation together.
Gotcha. Thanks very much, Laura. And thank you for that very generous introduction. As Laura mentioned, I'm the Executive Director of the National Institute on Aging. For those of you who don't know us, we are Canada's only policy institute focused on issues related to aging in Canada. We're located at Toronto Metropolitan University, and we convene stakeholders, conduct research, advance policies and practices, share information, and shift attitudes, all in the service of improving the lives of older adults in Canada and the systems that support them. We've been around since 2015 and have developed and produced over 60 policy reports on a variety of topics, predominantly focused on the fields of health and financial security, on subtopics around sort of access to medications and vaccinations. I see Laura's putting the link in the chat. Thank you very much, Laura. I will also be engaging you on my PR team with Benedict. So access to vaccines and medications, care and caregiving, particular health issues that have a disproportionate impact on older adults themselves. And on the financial security side, thinking about ways in which the Canadian retirement income system can be reformed to better meet the needs of aging Canadians. as well as ways in which sort of industry can think about doing what they do in ways that better meet the needs of aging Canadians as well. We're at a really exciting point in our growth trajectory. We're coming up to our sort of 10-year mark next year as an organization, and recently undertook a strategic planning exercise that clarified a few sort of key pieces of our work and our mandate, and we're really looking forward to working much more closely with the community sector, working more collaboratively with partners, and really leaning into some advocacy work and policy and advocacy work that will really, we hope, amplify and strengthen the work of so many people on this call and doing work elsewhere in the sector that supports older adults in Canada, excuse me. So perhaps I'll leave it at that for now and hand it back to Laura. Thank you so much, and looking forward to the discussion.
That's wonderful. Thank you. With that same invitation, I am delighted to introduce to the stage Professor Julia Gersovitz. You may know her from her work as an architect, an educator, an architectural historian, an author, an activist, holder of the Order of Canada. I've been absolutely delighted to welcome you into the field of aging, and she has gifted us back by co-writing a chapter, Architecture for Aging, in the recently published 5th edition of The Care of the Older Person. She and some of her colleagues in Montreal and Quebec have really taken up passionately how care at a personal level, how care at an organizational level is embraced by our personal interactions, as well as the quality of our experiences with the space that we live in. And I'll turn it over to you, Julia, for a bit of an introduction into what you do, a little bit about what you've been thinking about, and then we'll introduce our last panelist and open into our conversation.
Thank you, Laura, very much for this invitation. I must say to you, I'm completely humbled by attending this panel, because I feel very much that I have much to learn and not that much to give. But in any event, we will today just say the following thing. As Laura said, I first came into contact with CanAge through the research that I and my fellow author, Boris Dufoy-Morin, were doing for this book on care of the elder person, now in its 5th edition. And it was really to look at models, to expose the North American audience, which is really the audience for this book, to other models for care of people moving into and then deeply engaged in dementia, and how the Europeans are so far ahead of us in terms of understanding what can be done. And we wanted to try to expose that, and to also perhaps gently challenge the way in which the American health groups have taken on this model and then Americanized it, so that instead of it having perhaps more of the sense of dignity in person and individuality that it does in Europe, it became a kind of Disneyfication of many of the issues, and the spaces became more a sense of Disney than they did a sense of the kind of environments that are provided in European examples. But I also come to it as a child of a parent who lived just a couple of weeks short of his 103rd birthday, and lived very fully to the very end. When he was asked, as he unfortunately went to the hospital for pneumonia, one of the doctors said to him, what do you want us to do? And would you like us to put you into palliative care, which came as a surprise to us both. And he said immediately, I would like to continue. And I think those words sum up a very positive attitude towards this. And of course, as his primary accompanist on all of the inevitable doctor's appointments, no matter how well you age, you still are going to be confronting the medical system. I was shocked constantly by the fact that as soon as the doctor and any residents would come into the room, they would turn to me and ignore my father completely. And I would have to recalibrate the meeting by saying to them, my father is completely compos mentis. You talk to him. If there's anything he can't hear because he is deaf, I will be saying it again, but never for a moment underestimate him. And I think that that's something that I would like to urge everybody to remember and to promote, that people who are aging are not becoming somehow incapable. The last thing that I would just like to say is that I have spent my entire career in really in conservation architecture, which is, it sounds like a deep thing about restoring buildings, and I have worked across the country doing that. But really, it's about dealing with buildings that are already there, that are aging in time. And I think that if I could say something to you, we really need a more structural change of how our society, our culture approaches older people, in the same way that I'm constantly fighting to save historic buildings, old buildings, any kind of building. It doesn't have to be historic, it just has to be old. And people are saying, well, why do we have to keep that? Why can't we just tear it down and start over again? And in the same way that we should have the respect for what is already there in our urban fabric, we need to have that same attitude to understanding how we should honor our older generation. It seems to me twinned in some way. We just see ourselves as a disposable society of the aging, whatever it is. Maybe that sounds crazy, but I hope it doesn't. I'm done for the moment.
It's exactly the question that we need to ask. And what I loved was that comment, you know, I want to continue. I think that's a really important piece. It's now my great privilege and honor to invite Gregor Sneddon to the stage. Many of you will know Gregor as the Executive Director of HelpAge Canada. You may not know that he is also a well-known TV actor, musician, and chef. He is a man of many, many talents. But when he entered into the field of aging, we gave up a collective cheer. He has been tireless in his work with HelpAge Canada for the last 5 years, joining just before the pandemic and amazingly jumping into the very forefront of response communities, big and small. But he has also worked on the humanitarian crisis facing older people in other areas. Ukraine, has been on the ground in Ukraine, literally making sure that support and assistance goes to those in need, and making sure that older adults in war-torn countries are able to get some help and assistance, often who are the very last to get so. But that also includes countries like Ethiopia, Morocco, Syria, Kenya, and many, many others, as well as across our country. He's passionate about areas of digital literacy. He's worked in the areas of age-friendly transportation, often bringing forward the perspectives of rural and remote communities, not forgetting that Canada is a big country and not just made up of a few large cities. He has worked on aging in place, men's sheds, and the Age Better grant program. Many of you, of course, will be familiar with HelpAge Canada as part of the broader HelpAge International group. It focuses on supporting community-based seniors and organizations. And what I would also offer is that he has just with his team led the first big development in that sector, the community-based senior serving sector, by hosting together a several-day summit with folks from across the country, sharing and building out what it means to have a community-based sector, elevating what some of those challenges are and bringing them together. With that, I will invite Gregor to introduce himself, HelpAge, and speak a little bit about some of the work they're doing.
Thank you, Laura. If I could get that transcripted, I would appreciate it very much. Thank you. Thank you very much. Yeah, I tell you, it's a real privilege to be here with all of you and so many friends and colleagues that we were commenting before. We end up sharing a lot of rooms and chatting together on a number of occasions, and it's always it's just such a wonderful sector that we belong to with so many great people. So I'm just very thankful and privileged to be here. HelpAge Canada, we've been around since 1975. We're a founding member of HelpAge International that operates through a global network of about 200 members and active in about 100 countries. Our HelpAge Canada mission is really to support community-based initiatives that improve the lives of older persons and their communities. So we have a fairly broad charitable mandate in Canada, and we work, as Laura mentioned, all over the world. One of the things that happened to us as we were shared in our recent summit was in COVID-19, I was fairly new to the organization, and we were a small organization. We were able to pivot quite quickly and begin fundraising and supporting humanitarian relief for older people in Canada. And we were quite enabled to raise funds. Funds were coming in. It was definitely touched a nerve, but we had the hardest time finding organizations to distribute the funds to, and we began exploring and literally, Googling across Canada on and calling up organizations. Do you need money, and are you helping people? And exasperated executive directors or frontline workers, yes, help. And then they would get very suspicious. Who are you guys, and what's the catch here? And we discovered this vast network across Canada of these community-based organizations helping older people, and there wasn't really much coordination or communication amongst these various organizations, except for in a few areas. So one of the work that we're really excited about and engaging in right now is we're trying to support this development and trying to help convene or coordinate a national sector of the community-based senior services sector, and working with a national leadership council to try and move this work forward. We're working with many of the people on this call, including Alyssa over at NIA and Laura and many others, to try and move this work forward to address how, as community, the voice of community that really know the needs of the people in their community, to help build and develop a national coordinated sector. So aside from our programmatic needs in Canada and internationally, which in many ways are very similar in addressing the needs of older people, we're really excited to be working with so many partners to really develop and work together a national community-based senior serving sector. So glad to be here.
Thanks very much. And if we still have Saskia there, I will invite her back to the panel, and we will join for our key questions that we have today. So the theme of this year is both aging with attitude and be old, or bold, as we have put it in the chat here. So I've got a couple of different rounds of questions that I'm going to ask you. But the first is this, and this is my flash round, and I'll start off with it. What does bold or be old mean to you, given what you're experiencing in your work or even your personal life, if you'd like to share that? And Julia, you brought that up originally, that you were looking at sort of old buildings. It didn't necessarily need to be historic, but old buildings. So maybe I'll throw it back to you first and then go to Alyssa, Gregor, and Saskia. What does bold or be old mean to you in this context?
If you're speaking to me, I think it means bringing forward, we never see ourselves as the age that we may be physically. We always have some sweet spot that is our age in our head. We're 36 always, or whatever we are. I would say to you that we're a generation that came out of activism. We're not the passive generation that we're seeing now, that we are trying to reactivate. So we should be bringing our activism with us and challenging things that we are not happy about. I do not think we should accept anything that we are not feeling comfortable with.
That's wonderful. And it is that notion of activism as well, that we have to be keeping going. One of the things that I like best about World Elder Abuse Awareness Day is it brings together activists from all kinds of different fields. As you've seen in our panel today, we've got folks from many, many different kinds of sector. Alyssa, for you, what does the theme resonate with you, either what your work is doing or what you've been thinking about lately?
Sure. Thanks, Laura. And Julia, I am also 36 in my mind too. So I can relate to that. But I'm going to answer the question from sort of a professional standpoint. And if you'll forgive the little bit of shameless self-promotion for the NIA, I actually think our new revised vision is bold. We want to see a Canada where older adults feel valued, included, supported, and better prepared to age with confidence. It shouldn't be a bold statement, but it is in reality because there's such a long way to go to get there. And we know that older adults will soon make up a quarter of Canada's population. But that doesn't mean that we as a country have taken the bold steps that we need to make sure that we are a place where people of all ages can thrive, even though this demographic shift is known and has long been understood. We're going to get into this a little bit later, but I'm just going to, if you'll indulge me for a moment, we conduct an annual survey of older adults annually. We just launched our second one in January, and we're hard at work on our third one, which we'll be launching next January. And we found through that, perhaps not surprising to anyone on this call, but we found that older Canadians are facing some very real challenges. So almost 100% of older Canadians want to age at home, but the majority of public dollars go towards institutional care. As many as 41% of Canadians 50 years of age and older are at risk of social isolation, and up to 58% have experienced loneliness. Only 1/3 reported that they could afford to retire at their desired time. And only 45% said that they were able to access home and community care services all or most of the time. So I think being bold means challenging assumptions that underlie these challenges and really tackling these issues head on.
And now I want to know how, okay, you think you're 36. I think I'm somewhere between 9 or 21, depending on my opinion at the day. Gregor, what does bold or be old, what does that come up with you? And I kind of asking you also to think a little bit about that transformative meeting that you just hosted in Ottawa.
Yeah, I love that the saying that we say at HelpAge, aging is cool. Everyone's doing it. Let's face it. We are going through a massive societal, social, historical transformation. There's a saying that we say, the present moment, we can never assign meaning to the present. The present is a story later to be told. The present is a story later to be told. We're right in the thick of a transformation. I mean, in 1900, the longevity was about 60 years old. 1950, 68 years old. 2023 today, lifespan is 83. And by 2100, we project around 91 years old. And within just even a generation, we had an entire body of caregivers, which was, women didn't worked at home, took care of the family, and our elders often lived with us. This transition is only a generation or two. When the whole how families are changing, how our work life is changing, our roles and responsibilities. We live in a secular society. We're in the midst of massive change. And in many ways, our aging population, we have seen, as we saw in COVID, a terrible thing to say, but are the first kind of casualties of this amazing cultural change, and where we have not caught up yet. We still do not have the infrastructure. We see that all over the world. We know that as the population is aging, and the bulk of that population will be in low and middle income countries. But in Canada as well, as leaders, as age accessible or accessible cities, and our own self-awareness and awareness as communities of this invisible population that are here to stay. And we need to get with the program. So I think being bold is really about making that claim and attending to the fact that aging is cool. We're all doing it, and we need to create that that belonging and intentionality in all of our work, both starting from within ourselves, right up to our work in our families, our communities, and our work in society.
Yeah, that merchandise is already just writing itself. Someone already has t-shirts being, made with that signal on it, or, stickers. And if they haven't, I'm going to start doing that. I love it as well. Saskia, for you, what does being bold mean, particularly in the field of thinking about dementia in Canada?
Yeah, I was thinking about this question. I mean, when I think about bold, I mean, there is the activism, the vocal activism. And then I am an introvert as well by nature. And so I prefer the less quiet, but there's still activism in that as well. You don't have to be vocal. You can, there's activism in action. And I think about my grandmother as the perfect example of this, because she lost her vision in both eyes, and she actually had multiple neuroblastomas, which in the end was how she passed away. And at no point did she decide that because she'd lost her vision, she could not participate in all of the things that she always wanted to and continued to do. So, I mean, she was a very active grandmother. I remember her going out to the market. She lived in Sri Lanka. She'd go get everything, all the groceries. She'd take the bus back because no one could dare drive her back and forth or anything like that. She would walk, carrying everything back. She'd do and prep all the meals. She was also a nurse and did not retire until she was well into her 70s. And even though she'd lost vision, she was the most active member of our household. She still prepped everything. She still cooked. I mean, and consider that accessibility was very different and is still very different in a country like Sri Lanka, right? She still helped raise her great-granddaughter. She was still providing advice and support to people who were giving birth. She was a maternity nurse. That is bold. It is absolutely refusing to stay in your lane, doing what you're supposed to do, giving up, aging gracefully, all of the ways in which we think that people need to be was just not what she did. And that was really the inspiration for me, even with Brainwell, when Alex and I were thinking about and designing it. It was, why do we need to stay in our lanes if we know that this evidence can change and can move, and that we have to be vocal in some cases? In some cases, we might need to say things that people don't want to hear, but need to hear. Then that's fine. Then that's, if it's backed by the evidence and the data, and we have people living this every day, this is the only way in which we can continue to move forward. And that's how we envision bold, and that's how I try to live it every day. And by the way, I still, in my mind, am probably maybe 18, maybe 22. I still catch myself when I'm walking by the mirror. I'm like, who's that? Oh, that's me, right? So there we go.
I love it. And that aging with attitude is a hashtag that we're using as well. So don't forget, when you're thinking about this year's WEAAD and the events that you're hosting and being involved in, I love that Be Old and Aging with Attitude as part of our celebration for WEAAD. All right, the next one, my next go around, maybe I'll start with you, Saskia, just because we're going to pick up on what you've just said. You've talked a little bit about some barriers that we have very gently, but I want you to pull it out a little bit more. So what do you think are a couple of key barriers around dementia, and how should we overcome those barriers? Like, how does it connect with elder abuse? I know there's lots and lots of barriers. We don't have a science, we don't have as much, whatever. But when you're thinking of a barrier, I'm going to ask you to connect it with the idea of vulnerability or abuse. So toss it to you. And then Alyssa, I'll go to you, Julia, and Gregor. Again, thinking about barriers and how we connect to abuse.
So I'll maybe start at like the 10,000 foot level and then come down. If we're talking about it from a systems level, you know, I mentioned this, the national dementia strategy, and I'm going to come at it from a dementia lens. We have a strategy. Fantastic. We do not have implementation around it. We don't measure it. We don't know if we're actually achieving anything through it. We are putting some money behind it. But if we're not actually talking through what is it we want to achieve, how are we measuring this every day? Are we talking to people living with this disease and how is it impacting them? We have no idea if we're actually profoundly making the kinds of shifts that we want to make, specifically around dementia. If we look at it in terms of getting a diagnosis, and I talked about this in the presentation as well, family docs are not comfortable making a diagnosis. We did a national survey of family physicians. It was not a representative survey because it launched during the pandemic. You can imagine no one anticipated that. But the general trend, of the physicians, there were about 280 physicians who responded. 78% of them told us that they knew someone, they had a patient who was living with cognitive impairment, but they had not provided the diagnosis to them. And they didn't think it was necessary to. I mean, is there any disease and any other age where we would think that that's okay, given that dementia affects older adults? And then consider if the family physician was not comfortable providing that diagnosis, even though they knew the person had it, how is the family handling it? And then if we think about that from the perspective of vulnerability and abuse, I mean, you are no longer have the supports. You're not necessarily being taken seriously. You're going to retire and pull back from society. All of those pieces just compound as you go. So those are some of the just the very basic entry points. We haven't talked about institutional care. And this is another space and an entire industry that, again, it has been built on a very medical approach to how we think of people and how we think about older adults in particular. We don't think about purpose. We don't think about value. We don't think about a holistic person. So we are providing care in a very specific medical way where we're keeping a person's body alive, but we're not thinking about them as people, about what their value and purpose is and supporting that. And I think that's a broader cultural need in a community as well as when you think about it in institutional care. I think it's far more exacerbated. And then I just want to lastly say, we've not talked about it from the perspective of diverse older adults with language and cultural and values that are different, and how those intersect and play, especially if you're a new immigrant or you've recently, you're a refugee, and how all of those intersect in terms of accessing a healthcare system and the kinds of vulnerabilities that plays into.
Hugely important. Thank you for that. And understanding that when we're aging, we are the sum of all of our history as well, and the history of our ancestors in many cases as well. Julia, for you, when you're thinking about, having some of these conversations, even with your colleagues in the architectural or preservation space, how are they being received? Is this something that people are really talking about? What are some barriers that you have that you may have been able to identify in that, and how does that connect to aging in our best way?
I don't think that there's a hesitation to change the paradigm within the architectural profession in general. There may be people who are invested in a certain way of working and they don't want to find out that all the standards and the norms that they have usually been applying are suddenly out the window and they have to restart again. And so they may be resistant to it, but there's also a resistance we understand from, the decision makers. And I think that I just wanted to pick up on one thing that Saskia said, which I think is fundamental about the way in which the medical approach has informed the architectural decisions that people are using to build the buildings. One of the things that I think is an important thing to put on the table is our ability to assume more risk. And right now we are living in a very risk-free environment, and risk-free translates into not allowing the person to do very much because they might fall, they might do this, they might do that. And one of the things that I was particularly interested in the European models is that they're not wild and crazy, they're not cowboys, they don't embrace risk, but they understand that a certain amount of risk is necessary to live a life well. And they wish to have those lives lived as well as they can, as far as they can into those lives. And I think that is a question that is going to be very difficult to recalibrate, how we accept more risk. But I think it's fundamental. If I could just, at this point in the discussion, just put that on the table, I think that we perhaps can, I'll yield to my other panelists.
I think the notion of risk is really important. And I think it also falls within norms of what a good old person is supposed to be, and a good female old person, or a good racialized older adult, or a good, fill in the blank. And I think understanding that risk in life exists. I usually tell my students, look, Las Vegas exists for a reason, and it's really popular. Is it only for younger people? Let's think about that for a moment. And that helps to sometimes reframe. But often when we're thinking about building and building structures, we are thinking about obviously keeping people safe. But there's the question about, are we keeping people safe to the point that they don't actually want to live where they live? And that, I think, is building on Saskia's point as well around some institutional care when it comes to dementia. Alyssa and Gregor, over to you. Talk to me about a couple of barriers and how that connects with abuse. Alyssa, over for you.
Sure. Thanks, Laura. I think there's two things here for me, from my perspective. One, broad kind of general attitudes towards aging, and sort of from there, the political will to make those kind of transformational changes we're looking for. So when it comes to attitudes towards aging, I've seen three, I'm sure there are more, but I've seen three narratives play out that I think affect how we approach public policy decisions about aging. The first is that aging is predominantly, or should be solely, viewed as a cost to society. We see a lot in the media about the cost of long-term care, the cost of healthcare, rising costs of programs like old age security. And those are all real and valid public policy challenges to work through, to be clear. But Gregor mentioned earlier the increase in longevity. We've effectively gained 2 extra decades of life in the last 100 years. It's extraordinary. This is a triumph and something that should be celebrated. If we think about the contributions that can be made with 2 extra decades of life, it's extraordinary. And when we survey older adults in our survey, we see a very different perspective than this focus on costs. About half of the respondents to our survey report that as they've gotten older, their feelings about aging have become more positive and their life is better than they thought it would be. Second narrative is that older adults are a homogenous group, namely wealthy, home-owning baby boomers. But in reality, the reality is quite a bit different. In our most recent annual survey that launched in January, we found that 1 in 4 older adults said their income is not enough for them. So they're either financially stretched or they're having a hard time. 1 in 4 older adults are renters, which is not far off from the general population of Canada as a whole. But keep in mind as well that we, the context of record low vacancy rates and housing supply, the record high rent, as well as record high rental costs. So there's this real misperception that older adults are often assumed to be homeowners and immune from some of these broader economic trends. We have an official poverty line in Canada, the market basket measure, but this was not designed with the needs of older Canadians in mind. If you look at this measure, only 5.6% of Canadians over 65 are living in poverty. But if you use the low income measure, which assesses the proportion of the population that live below 50% of the median income, the proportion of older adults in poverty jumps to 17%, which makes them one of the worst off demographics in Canada. There's quite a bit of misperception around sort of the economic circumstances of older adults. The third narrative is that ageism is not prevalent and doesn't have the same real world harms like other forms of discrimination. To be clear, and I know I don't need to say this to anybody for the benefit of anyone on this call, but to be clear, ageism is discrimination, and it is as unacceptable as any other form of discrimination. Our annual survey revealed that 1 in 3 Canadians 50 and older reported having previously experienced discrimination or unfair treatment because of their age. But when we ask those same people if they have experienced some specific everyday experiences of ageism, things like being exposed to jokes or comments about older adults, that number jumps to 71%. That is unacceptably high. The government did consultations about ageism in 2022 and found that the most common settings were public settings, workplace settings, and healthcare settings. And in particular, people reported discriminatory policies and practices in the workplace, things like lack of accommodation, being excluded from extended health benefits, being pressured to retire at the age of 65. And of course, in the healthcare setting, participants discussed feeling like their symptoms were ignored because of their age, or that, as was mentioned, I think by Julia, that they didn't have a say in healthcare decisions or weren't even being spoken to by some of the care practitioners. So we know that ageism is having a real world, tangible, and negative impact on older adults. But because our negative beliefs about aging are so deeply entrenched as a society, many people may not immediately recognize that this form of discrimination is happening. And
amazing.
Then,
oh, go ahead,
can
please.
I just say one last piece? And all of this comes together and has a real impact on public policy. So decision makers themselves are not immune to these biases. Biases, of course, though, are not the only barrier. So some of the biggest shifts we need to see are transformative system changes. For example, reorienting from institutional care to better community supports. This brings in considerations like funding allocations, human resource considerations, physical infrastructure investments, jurisdictional negotiations about standards, and a whole bunch of things. And of course, all of this takes time, as well as political will, which is challenging given sort of 1 to 4 year political cycles. I'll leave it at that.
Absolutely. Thank you so much. And just such response around ageism. Of course, the World Health Organization found that ageism is the single most prevalent form of discrimination in the world. That's true in Canada as well. And then, of course, bringing in intersectionalism only layers additional forms of barriers to that. Gregor, last over to you to wind us up, and then I'll say thank you. So what barriers are you finding?
Just on following on the other my colleagues' points, ageism is key, and we experience that on the international front and our humanitarian work. We're always considered to be sort of some boutique niche group, whereas, for example, in a place like Ukraine, 1 in 4 people are over the age of 65. 35% of those killed at the beginning were older people. It's the highest density of older people in any conflict zone in the world, and yet it's it's a terrible joke, but in our work, it's easier to raise funds for children and puppies than it is for the aging space. And I think this really comes down to ageism and our lack of awareness. Our society has lost its last intergenerational spaces, for example. And so it leaves older people become more and more invisible and hidden. And I think that is often elder abuse. We don't even hear about most of it. It's mostly hidden. It's a cultural taboo in many communities. New Canadians, we know that it's not, it's hidden. They aren't given the space to share their own struggles, as well as in our own, we know in our own communities in Canada, for example, dental care. You get dentures, you can't afford to have your teeth fixed. So you stop smiling, you stop going out, isolation and loneliness, it becomes compounding, and a lot of older people end up so isolated and lonely that the abuse that they experience is hidden. We need effective systemic response mechanisms to be able to address abuse that happens in our communities. We need to socialize and normalize the aging experience and intergenerational encounters and opportunities in our society as a whole. Finally, I would just say that, many of us who are working in this space, at the community level especially, that we know is responsible for 80% of the determinants of health are social. The social determinants of health comprise 80% of the determinants of health. we're so underfunded. We're exhausted, exasperated with very limited funding. These community organizations, again, are seen as boutique or, oh, just the volunteers will take care of it. But we need resources and capacity to address and work with older people in our community, especially when it can be so hidden.
Yeah, and that's the perfect way to conclude. I wish to thank our incredible keynote speaker and a fabulous panel to connecting the work that they're doing in disparate areas of policy, community-based sector, architecture, care, and dementia. And I'm going to ask you all of us today, our call to action to identify specifically the barriers that we are facing, because unless we can call out those barriers, we cannot work together to overcome them. I'm going to also suggest, building on Gregor's point, many organizations today, like the CNPEA, like Elder Abuse Prevention Ontario, NIA, HelpAge Canada, my organization, CanAge, we are all pulling together, and donations are something that many people would like, or your organization in your area, please feel free to share that information. I also am going to ask Benedict to jump on with our final close, some quick reminders about WEAAD, because we know many of you are also engaging in WEAAD events, and I want to make sure that you have all the materials. I will turn it over to Benedict, our awardee this year, for our final close.
Thank you so much, Laura, and thank you all today. This was such a fantastic talk. I wish we could do this for hours. I would listen to you all day. If you are looking for more activities for WEAAD, particularly for our Francophone speakers, Rhiannon, if we can go back just one slide, there is an event taking place tomorrow, June 13th at 10:30 a.m. Eastern, organized by our Francophone partners, La Farfo et le RP Mafo. They are doing a wonderful webinar with Louise Bélanger-Hardy and Francine Goyette, who are going to talk about ageism and about intergenerational approaches as an antidote to that ageism and what it entails. There's, of course, more going on this week. I mean, you know, we know you all have a lot going on for WEAAD. Please remember to support the campaign Age with Attitude, both in action and in words on social media. We have developed all sorts of promotional materials you can use. The link is on the screen. You can download them all. You can use them freely. You can repurpose them however you want. This is what we created them for. And again, I posted it in the chat box. You can now see it on your screen as well. We would not have this event in place, and we would not have reached all of you without the support of our provincial and territorial partners. You can see them all on the screen here, from BC all the way to Newfoundland and Labrador. Thank you so much for your help in building this event, choosing the theme, devising everything that went into today's activities. It's a pleasure to work with you. And like Laura was saying, and like many of us were saying on the chat today, we're all, you know, doing this with very limited funds and very limited support sometimes. So all your support for Seniors Month are welcome. If you can consider a donation, the links are on the screen, eapo.ca/donate, cnpa.ca/donate, and CanAge.ca/donate. And as I mentioned at the start, we have a little evaluation for you. If you have a minute to do it now, it would be greatly appreciated. Let us know how we did. Let us know what more you want to hear about for our next events for the coming year, because now that we're done with today's event, we're going to start planning next year's right away. And we're going to use what you tell us as inspiration. So thank you for your time. Thank you for being here with us and being so passionate in the comment section as well. We appreciate you and your time. Laura, thank you for being the MC extraordinaire as always, and Rhiannon for making this whole thing run so seamlessly. Thank you to our interpreters as well for making this more accessible to everyone. It's been a pleasure as always, and we'll see you very soon.
Happy WEAAD, everyone. Thank you. Merci à tous.
Thank you, everybody.